Thanks to Shopify for supporting Future Hindsight. Shopify is a platform designed for anyone to sell anywhere, giving entrepreneurs like us the resources once reserved for big business. Sign up for a $1 per month trial period at shopify.com/hopeful, all lowercase. Thanks to Aura for supporting our show. Go to aura.com/protection for a 14-day trial, plus a check of your data to see if your personal information has been leaked online, all for free. Happy 4th of July from Future Hindsight. On this Independence Day, make plans to protect our freedoms, our rights, and our very democracy. After the Supreme Court's decision on immunity this week, it's clear that our democracy is at the brink of extinction. So, after you listen to this episode, stop everything and make sure that you are registered to vote. Tell all your friends and family too. And then turn out for our democracy on Election Day. Welcome to Future Hindsight, a podcast that takes big ideas about civic life and democracy and turns them into action items for you and me. I'm Mila Atmos. It's 2024, and the future of America is in your hands. Democracy is not a spectator sport, so we're here to bring you an independent perspective about the election this year and empower you to change the status quo. We all consume healthcare from the very moment we are born, but the U.S. health insurance and healthcare systems are so burdensome to figure out that we feel hard-pressed to actually see a doctor when we need to. Despite the implementation of the Affordable Care Act 14 years ago, making access to health insurance more accessible and giving us all high hopes for better health outcomes, much work still needs to be done. So, what do we still need to do? And why does it matter? And finally, what is the intersection of democracy and healthcare? To help us unpack these questions, we're joined by Melanie D'Arrigo. She's the executive director of the Campaign for New York Health, which aims to win universal single-payer healthcare for all New Yorkers. Welcome, Melanie. Thank you for joining us.
Thank you so much for having me, Mila. It's a pleasure to be here.
A conversation about healthcare could go in so many directions, and I think we'll cover all the bases. And I want to acknowledge here that because of the Affordable Care Act, a lot more people have gotten access to health insurance and, by extension, health care. But with insurance rates rising and some states still not taking up federal funding for Medicaid expansion, a lot of people continue to be uncovered. So before we get into the nitty-gritty of healthcare, health insurance, et cetera, let's get the lay of the land. What is the state of healthcare in the United States today?
Wow, that's a heck of a question, Mila. I don't think it's a stretch by any means to say that the state of healthcare in the United States is severely broken. We are the only industrialized country in the entire world that does not have universal health care. We pay the absolute most for health care, health insurance, to get access to health care than any other industrialized country, and we have among the worst health outcomes in the world. So we're essentially paying a lot more, and we're getting a lot less.
Yeah, that's really shocking. Can you give us an example that stands out to you that really shows us the difference between us and them?
Yeah, well, we have the most comorbidities of any other country. Our life expectancy at birth is among the lowest, and it's been decreasing in recent years, which is really shocking considering the amount of money we're pouring into the system. Maternal health is abysmal, and of course, it gets worse if you are a Black or brown woman. It's a real stain, I think, on this country, and it doesn't have to be this way. And that's why I'm so excited to be here, Mila, to talk to you about some great solutions that we have.
Yeah, let's get into it. You are the executive director of the Campaign for New York Health. Tell us about what that is and why New Yorkers need it.
Absolutely. So the Campaign for New York Health is a social welfare organization, and we are solely dedicated to passing and implementing the New York Health Act. Now, the New York Health Act is a current bill in the New York State Legislature that would implement a single-payer system, single-payer health care in New York for every single resident. It would leave no one behind. It's an amazing piece of legislation that would be a significant upgrade over healthcare today. And I'm excited to dig into the details, but what I would love for your listeners to understand is that the New York Health Act would make it possible for us to access healthcare. Right now, we access health insurance, right? And insurance agencies, they really act as middlemen and complicate and muck up the process. They drive up the costs. We get less care for a lot more costs. The New York Health Act would simplify that process. We would have no more copays, no more premiums, no more prescription costs. There's a balance. We'd pay a little bit of a tax. It's not exactly free, but, there's a sliding progressive scale in terms of what we would pay. But on the other end, we would get all of our medical care covered. We would also throw in dental, vision, hearing, which of course are all extra today. And what's really exciting about the New York Health Act, at least for me, is that long-term care is included as part of our comprehensive health benefits. That does not exist anywhere in this country. And it would be so helpful for, senior citizens who need this care, for disabled people who need this care. Right now, that is a completely broken down piece of our healthcare in our country. So the New York Health Act would eliminate so many of the issues, so many of the barriers, and every single New Yorker would be able to access care when they need it.
Right. That's amazing about the New York Health Act and the campaign. We actually just had a conversation with Assembly member Jessica Gonzalez Rojas, and she mentioned the New York Health Act. I know it was first put on the floor in 1992 by Dick Gottfried, a super long time ago. It's now 2024. Tell us about the history of this bill and where we are today, and also what's it going to take to pass this bill?
Yes, it's such a great question. Well, first of all, I just want to say Assemblywoman Gonzalez Rojas is an amazing champion of ours. She's a real fighter, and we just appreciate her so much, all the work that she does each and every day. She really is a true fighter. Former Assemblyman Dick Gottfried is still very involved in the movement. He did introduce this bill in 1992, and I do understand that folks listening might say, well, 1992, that's a very long time. What's going on, right? There's a myriad of barriers, of course, that have been thrown in the way. But before we dig into that, I think it's important to mention that any major change that has ever happened in this country has taken a significant amount of time. Sometimes we like to think that it happens in a year, it happens in 2 years. It feels like that sometimes, especially when you're new to a movement. But that's just not how these transformative bills take place. It's not how they're passed. It's the dedication and the daily grind of advocates and legislators and labor partners and different organizations who are really chipping away at it each and every day until we hit this crux, this crucial point where the dam breaks and then we push it through. It's been around a long time, but for me, that gives me hope because we already have that rooted foundation and it's strong. We're growing each and every day. We're bringing in new coalition partners. And I think, we're doing a great job educating people, although there's more work to do. So if there are anyone listening wants to get involved, you can reach out to us and we're happy to bring you into this fight. I also just want to quickly mention, we do have 2 bill sponsors. So in the Assembly, we have Assemblywoman Paulin. She's the chair of the Health Committee. And in the Senate, we have Senator Gustavo Rivera, who is the chair of the Health Committee in the Senate. And he is a super champion. And he's out there educating on the New York Health Act and trying to push it through each and every day. So we've got some great partners to work with. But in terms of how do we pass it, I mean, that's the million-dollar question, right? And I think that's sort of the crux of the work that we do at the campaign. And I think there's a variety of what I call sort of verticals, right? Different strategies that we're working at any given time that are very integrated, but also sort of work separately, right? And so there's a legislative strategy. We're always trying to bring new legislators on board. We're always trying to move them along the spectrum. They might support it, but if they support it, we want them to be a champion. So how do we move them along that spectrum? There's the community, right? We want to make sure that constituents are engaged and they're educated and they know what the New York Health Act is, right? So there's that piece of it. There's communications and getting the word out, and that's part of being here today. And then there's fundraising, right? Anytime you're trying to do something, pass a bill that works in service of people, when it serves to potentially cut into profits of big industry, that's always a big fight, right? So we're working various strategies as we kind of move this bill along.
This reminds me of the fight to overturn Roe, because that was a 50-year-long battle for the pro-life movement. And it makes me feel like, it's okay for the bill to have been around for a long time as long as you keep building onto the movement and getting more people excited about it. So, I'm a New Yorker and I've lived here a long time. It's honestly the first time I've heard about it. So where can people find this information? And since it's been around since 1992, what else do you think needs to happen for everyday people, everyday New Yorkers, to understand that this is happening and they can demand this from their elected representatives in the state lead?
Yeah. Well, our website is nyhcampaign.org, and we encourage listeners to come and visit us there and learn a little bit more about the campaign. You can also sign up there to become a volunteer or get involved, come to one of our many events. We do a lot of community outreach, so that's always an easy way. But something I think is very important that, the average person may not be aware of, right, is that our elected representatives, our assembly members, our senators, and then even local representatives as well, and of course federal, they're there to work for us, right? They're there to work for our communities. And a lot of folks don't realize that we can reach out to them. We can send their office an email. We can, even better, if we can give them a call and talk to them about legislation that's important to you. Now, we'd like to think that every legislator is aware of every single bill, but that's often just not the case. Especially in New York, we're passing tons of bills. Bills are being written all the time, and a lot of times not every legislator is aware of it, right? And it's hard because, especially for a people-led movement like the New York Health Act, right? Because again, we're up against these million-dollar industries who can crush it if they want, right? And I think they've done a lot of work to try to crush us, but I think it speaks to the testament of our movement and the passion of our people that we continue to chip away. And we're not going anywhere, right? We're going to keep at it, and we're not going to let up until we pass the New York Health Act.
So you talked about this earlier, about what the New York Health Act would do. And right now we have this patchwork of Medicare for the elderly and the disabled, Medicaid for the indigent. We have the marketplaces for the Affordable Care Act for people to buy insurance. We have young people on insurance with their parents until they're 26. So how does the New York Health Act solve for that, or does it?
Yeah, well, it's interesting, even just listening to you, I'm like, wow, Medicare, Medicaid, what's exchange? There are all these pieces swimming around, right? Which I think really lends itself to a more broken system. When you have all of these different pieces, these different components, there's more opportunity to manipulate it, right? For big industry to take advantage of it, to privatize it, which of course is what we're seeing. And that it does not bode well for us as individuals. It does not bode well for communities or for the people of the state or of this country. So moving to a single payer system like the New York Health Act in New York really simplifies the whole thing, and it cuts down on incredible cost, incredible waste, right? So currently, the way private insurance system would work is that, hospitals and doctors would charge, there's administrative costs involved in that, right? They have to jump through all kinds of hurdles to get pre-approvals. They've got to fight with the insurance company, make sure something's covered, try to get the right medication covered if it's not in a certain class that works with a certain plan. It's wild. It's like the wild, wild west that we're living in when we think about our healthcare system. So the New York Health Act would completely do away with that, right? So we would save on provider costs. We'd save on hospital costs. We'd cut out the high charges of insurance companies, right? So, the doctors are fighting with the insurance companies to get pre-approvals. Is it in the insurance company's best interest to approve that? Of course not. Of course it's not, right? So they're trying to fight back. So there's cost involved there. There are bloated salaries. And as I said earlier, they're the middlemen, right? So we're paying them for what? It's a lot of waste. And plus, we have 20 million New Yorkers. We're able to negotiate for prescription drugs, and that drives down the cost as well, right? So there's a lot of savings within the New York Health Act. And, many studies have shown this over and over again. By cutting down on those costs, even with adding in those amazing benefits that I spoke about earlier, like dental, vision, hearing, and long-term care, even when we add in that additional costs, there's so much savings when we get rid of that waste that we're able to implement the New York Health Act at a more affordable cost than what we're currently paying now. And we're able to streamline it. It's less complicated. They don't have to fight with 100 different insurance companies because there's one plan. There is the New York Health Plan, and everyone's in it. And we're able to better control costs, and we're able to ensure that every single New York resident gets the care that they need.
Let's get into the nitty-gritty because I want to understand that this actually is a new insurance company, essentially, or like we all pay in. It's like a cooperative. Tell us how it works. How much would we be paying? Because right now, I think people are paying, I don't know, between $700 and $2,500 a month out of pocket for their insurance, depending how many you are in your family, et cetera, et cetera. Let's go there first. How does the single-payer market work?
Right. And so I think that's so important because most people, if they're on a private insurance plan, right, those folks, they sort of forget what their health insurance costs really are, right? Because you'll start a new job, you'll sign up for your insurance, and then it comes out of your paycheck. And so you never really see that money. It almost feels like you never have it because it's constantly coming out of your paycheck. But for most people, those costs are very significant. But in addition to those premium costs, every time you go to the doctor, there's a fee. Every time you have to get a prescription, there's a fee. And sometimes it's a copay. Sometimes you have to meet your deductible. There's an incredible rise of high deductible healthcare plans, which is leading to a whole other problem of being underinsured. So we have all of these costs that we're paying now, and they're totally unsustainable, right? And we know this because we've got industry that wants to make a profit. And that is what is, by and large, driving up a lot of our costs. Under the New York Health Plan, we would think of it as one big statewide system, right? And instead of paying your premium and then having to guess, I don't know will I get sick this year? Will I break my arm this year? Do I have a condition where I know it's going to cost me a certain amount of dollars? Most of us don't really know. So it's kind of a guessing game. Under the New York Health Act, there would be a progressive tax where 92% of New Yorkers would pay less than they currently do now. And then we would be able to access care. So you would go to doctors, any doctor that you want. There's no more restrictive provider networks. You're able to go to the doctor. You don't have to fight to try to get your medication covered. You don't have to fight to get your MRI covered for your, potentially your knee or your elbow or whatever issue you're having. You're able to just access care. And I want people to think about it like instead of financing health insurance, we're financing health care.
Right. And it comes out of your taxes, you're saying.
Correct. And I know people get nervous and they say, oh, my goodness. Yes, it is true. Nobody likes to pay taxes. That is true. But we have to think of it as like we're already paying for it, right? It's not so much that you're paying your current costs and now there's an additional tax. That's not what's happening. I always say to folks, it's like 6 of one thing or half a dozen of another. It's just the payment mechanism. It's really sort of being diverted. But as I said, for most people, they're going to pay a lot less money. For the folks at the very, very top who might be paying a little bit more to balance out the system, I think it's important to remember that they're getting a lot more. You're getting long-term care, dental, and hearing and vision in addition to your medical care. But you're also contributing to better communities. Study after study shows that healthy people are happier people. We're more productive people. We're better able to take care of ourselves, right? When we're feeling good. There are so many rippling effects that ensuring people get the care that they need when they need it will have on broader society as a whole.
So what's the tax rate that you're proposing to pay for this?
So there's not a specific tax rate yet. And the way that the bill is structured is that once the bill passes, it will be up to the governor to decide how the bill is completely financed, right? And so there is one component in the bill that says that employers will pay at a minimum 80% of the tax and employees will pay no more than 20%. And we do have this here in New York. There are generous employers who will want to cover a little bit more. Some won't, but some will. But even in that model share, it is still estimated that 92%, and in some studies a little bit more, but I like to go conservative, but 92% of New Yorkers will pay less than you're currently paying. But ultimately, it will be, of the governor's discretion. We're constantly working at the campaign to look at different financing mechanisms and models to see which one will benefit the most people.
Right. So to be clear, though, that if you are on Medicare, let's say, that you would continue to be on Medicare, or if you're on Medicaid, you would continue to be on Medicaid. And this is really for everybody else who buys insurance in the open market or through the exchanges through the Affordable Care Act, or no?
No. So I have to be careful how I say this because I don't want to scare folks. If you have Medicare, you'll still have your Medicare card, but this will serve as sort of a wraparound service, right? So many folks love Medicare, and I think the New York Health Act, or at least I think of it as almost an expanded Medicare. So folks on Medicare now, they do not get long-term care, and this would be a huge boon and a huge addition. So it serves as one plan, but those folks would still be able to, retain their Medicare card.
And what about Medicaid? Because basically they don't pay for insurance. If you have Medicaid, you're not paying into the system.
Right. So, we're getting really wonky in terms
let's
of how
do
we
it.
talk about it. But, so what New York would do is we would apply for a waiver. And there is federal legislation right now that would grant waivers for states that are trying to move to a single payer system. But regardless of whether or not we get that waiver or we don't get that waiver, we feel very confident that, it's sort of a back end wonky system. We get federal money for Medicaid. We get federal money for Medicare. That money would then get moved into the New York Health Fund. So all of those folks would be under the New York Health Plan. So if you had Medicaid, well, you're still going to get all these benefits of the New York Health Act. If you are on Medicare, you're still going to get the benefits of the New York Health Act. So every single New Yorker gets the same benefits, which are way better than any plan in existence today.
Yeah, I get it now. So basically, one system would take care of everybody and then collect the dollars, if there are federal dollars, and then make sure that everybody who was previously entitled to them can continue to access them.
There will be federal dollars, right? Because we do get federal money, as I said, for Medicare and Medicaid and CHIP. But all of that money would get pooled into the New York Health Fund. So if I'm, currently on a private plan, instead of paying an insurance company, now I will pay a little bit in taxes that will go, and then I would be able to access my medical, dental, vision, hearing, and if I need long-term care.
Yeah, that's pretty amazing.
It's really amazing.
Yeah, I'm surprised it hasn't caught on, that people don't even know that it really exists. And, I'm a person who's well-read and well-informed. And I was like, what is this? This is really amazing. So does it exist anywhere else?
So there are many states right now pushing to implement similar systems in their states. We have not yet broke the dam, so to speak, but I think we're getting very close.
You think you're closest in New York, or there are other states that are maybe closer?
I
You're like, wait, what are they doing? And maybe we can do that too.
No, look, I think when one of us wins, we're all going to win. I really do believe that once one state pops through, it'll have kind of a popcorn cascading effect throughout the country. And then I think, over time, we'll start to see a push on the federal level. Ultimately, those of us in this movement, we do want to see a federal plan. I think you don't come to this movement if you believe only some people should have health care. We want all people to have health care. But yeah, I think there's been a lot of progress made in a lot of different ways. And so we try to learn from each other in different states, but we're always cheering each other on because, it's certainly not a competition. As I said, when one of us wins, we're all going to win.
Right. I believe that. So how does this differ from Medicare for All?
Yeah. So Medicare for All is the federal legislation for a single-payer system. The New York Health Act is a single-payer system on a state level, whereas Medicare is obviously a federal bill. There are a few differences within the bills, but essentially how it works for the average person is virtually the same. They're going to get access to health care, and I don't mean it like it's used by insurance lobbyists. I mean, they're going to be able to go to the doctor when they need it. They're going to be able to get their medicine when they need it, and we'll be a much healthier country for it.
Yeah.
That could be why you haven't heard of the New York Health Act. In 2020, in the presidential debates, for the first time, we were hearing these debates about universal health care, which was really, really exciting. Sadly, that has dissipated a little bit, and I think we're starting to see the states really start to ramp up because of that.
Right. We're taking a short break, and we'll be back with Melanie in a moment. But first, Sonny and Cher, Abbott and Costello. What about the perfect duo when it comes to growing your business? That's you and Shopify. Shopify is the global commerce platform that helps you sell at every stage of your business. From the launch your online shop stage to the first real-life store stage, all the way to the did we just hit a million orders stage, Shopify is there to help you grow. Whether you're selling scenic paintings or offering bespoke belts, Shopify helps you sell everywhere. You heard that right. From their all-in-one e-commerce platform to their in-person POS system, wherever and whatever you're selling, Shopify has got you covered. Shopify also helps you turn browsers into buyers with the internet's best converting checkout, 36% better on average compared to other leading commerce platforms. Sell more with less effort thanks to Shopify Magic, your AI-powered all-star. Shopify powers 10% of all e-commerce in the U.S. It's the global force behind Brooklinen, Rothy's, and Allbirds, and millions of other entrepreneurs of every size across 175 countries. Plus, Shopify's award-winning help is there to support your success every step of the way. Because businesses that grow with Shopify. No matter how big you want to grow, Shopify gives you everything you need to take control and take your business to the next level. And that is what I love about Shopify. Sign up for a $1 per month trial period at shopify.com/hopeful, all lowercase. Go to shopify.com/hopeful now to grow your business no matter what stage you're in. Shopify.com/hopeful. Doesn't it feel like there's a major leak of personal information just about every week? I'm sure you've read about the recent ones at major phone and healthcare companies. It's a scary thought that your information, your full legal name, email, home address, phone numbers, credit card info, and more, can all easily be found online. Data brokers can get your data legally from public tax records, credit card companies, cable and internet providers, and sell it to anyone who will buy it, even scammers. So what do we do? Aura is a great way to try out a great VPN. We're thrilled to partner with Aura, the all-in-one online safety solution that helps protect your information. Aura is offering you a 14-day trial plus a check of your data to see if your personal information has been leaked online, all for free when you visit aura.com/protection. And that's not all. Aura is a great tool that monitors identity theft, financial fraud, and other online threats before they happen. With Aura, you can rest easy knowing that someone is looking out for you. And it's really easy to use. Aura offers a suite of tools to protect you, including real-time alerts on suspicious activity, computer virus protection, a VPN, password manager, and even parental controls. It's a comprehensive online safety solution that provides almost every tool you'll ever need, all in one place. My favorite thing about Aura is how it helps reduce annoying robocalls, telemarketers, and junk mail by sending takedown requests on your behalf regularly. That's just a huge weight off my shoulders. And hey, if you're looking for a gift for someone in your family, this will be a unique one, and it will give them the protection they need online. I'm thinking about giving it to my brother. For a limited time, Aura is offering our audience, you, a 14-day trial plus a check of your data to see if your personal information has been leaked online. All for free when you visit aura.com/protection. That's aura.com/protection. Certain terms apply, so be sure to check the site for details. We also want to share about a podcast that we think you'll enjoy called What the Health.
If you're enjoying the show, here's another podcast you'll like, What the Health. I'm Julie Rovner, host of the show and chief Washington correspondent at KFF Health News. Every week, top reporters from outlets including the New York Times, Politico, and CNN join me to discuss the latest health and health policy news. Confused by all the health policy jargon? We'll break it down in terms that are easy to understand. What the Health from KFF Health News. Listen wherever you get your podcasts.
And now, let's return to my conversation with Melanie D'Arrigo. Well, so now that we've done a deep dive on the policy side and how it actually work in theory. Let's connect the dots on the lived experience. What's a story that you like to share with people when you're out there drumming up support for the New York Health Act to persuade them that passing this bill is necessary?
Yeah, that's a great question. So there's a story that I've been telling for many, many years, and it's not exactly personal, but I think it really encompasses what we're trying to do here, right? And so if we think back to the early days of the fire department, which an insurance company actually developed fire departments, a lot of folks don't know about that. But what would happen would be you'd pay your insurance company for fire insurance, and then you'd get this little plaque and you'd hang it on your building or your house or, your structure. And if there was a fire, the fire department would come. And there was great competition, right? Because if you were the first one there, then you would get the insurance payout. And so, there was a fire, you come, you check for the plaque. If it's there, you put out the fire. And what do you think, Mila, would happen if there was a fire raging and the fire truck pulled up and there was no plaque?
They don't put out the fire.
They don't put out the fire. They let the building burn.
That's crazy.
That's crazy, right? That's crazy. And, I tell people that, one day we're going to have our children and our grandchildren come to us and they're going to say to us, did you know in the early days, insurance companies were these barriers to healthcare and you had to pay insurance companies to try to go see a doctor, and people who had all kinds of diseases couldn't get the care they needed if they couldn't afford it? Do you know what would happen, Mom? Or do you know what would happen, Granddad? If people couldn't afford their medicine, they just let them die. And I don't know that that's a world I want to be part of, right? And that story I tell because sometimes, people will think about universal health care in this country, in America, and they'll say, well, that's such a radical idea. That's just so out there. And, I think it really speaks to a larger issue of how propagandized we are in this country, because we are the only developed country that does not have universal health care. And I think that it's really radical that we allow millions of people to die each year because we don't want to give them health care, that we allow millions of people to go into medical debt, which is a uniquely American problem, because we don't want to give them health care when we have all the tools to do it. And the legislation is there. I mean, we are not ahead of the curve. We're not doing something radical. We're trying to play catch up with the rest of the world. So that, to me, is the story, that I like to tell, because I want people to realize what's at stake here.
Yeah, that's a good story. I have a friend who is Norwegian, lives in Norway, and her son had an accident. He had to be in the hospital, had to have surgery on his eye. Everything is fine, but she just talked about how easy it was. She was living here for a little bit. She actually gave birth to her son here in the United States and moved back to Norway. And she just said, listen, it just was super easy. You check in, they take care of him and his surgery. I got to stay in his room because I'm his parent, and I think he was maybe 10 years old at the time. And it was the kind of thing where no questions asked. Of course, you got the family room, and it was a matter of course. Right? And it was the kind of thing where, of course, her taxes also pay for her health insurance. And I kind of feel like, to your point, that we're paying for health insurance anyway. We might as well pay for it through taxes and make sure that everybody gets covered in an equitable and actually equal way, right? Not just equitable way, because if you are seriously ill, it all is going to get taken care of.
Mm-hmm. We're paying for health insurance. We might as well pay for health care.
Right? That's right. We should be paying for healthcare as opposed to health insurance.
I have a cousin who lives in Ireland, and she had come to visit a few months back. And she was telling me that she got her gallbladder removed. And I said, oh, I had my gallbladder removed a couple years ago. And we thought it was kind of funny. And then she told me, I went to the hospital. I can't remember now if she said she stayed a day or two in the hospital. And she's like, it was about $200. That was the cost. And I said, oh, wow. I went to the hospital and I was out in about 3 hours. And I ended up with thousands of dollars to pay. And she said, what? And I said, yeah, I know. They should have paid me, right? They took my organ, right? But it's really interesting when we're having these conversations with folks who live in different countries, who are able to get health care for little to no cost. Whereas us, we're sitting here trying to decide, well, should I pay the rent? Should I pay my electric bill? Can I afford to get my kids soccer lessons, or do I need to pay for my medication this month? Like, that is a uniquely American problem that should not exist. I do have a hack, though.
Yeah, tell us.
This is terrible. This is a terrible hack. I ended up having a GI issue in March. I was rushed to the emergency room. I fainted, and I was in the hospital for 2 days, and they were doing all kinds of tests. And I hit my out-of-pocket max. So what now I think we have to do until we move to a universal healthcare system is make sure we hit that out-of-pocket max early, because most people don't realize that it resets every year, usually January 1st. So if you hit your out-of-pocket max in December, you're resetting and having to pay it again. So hit it early and then go see every doctor you can.
That's a good hack. That's a good hack. So does this mean that health insurance companies will go out of business?
It means that health insurance companies in New York will no longer be able to sell health insurance products or the health insurance product that they're selling today. Now, insurance companies do sell other products, so they can continue to sell them as long as they're not medical benefits. They could potentially create a new product for elective surgeries. I think in New York especially, there might be a market for that, right? That is something they could potentially do. But yes, it does mean that the New York health insurance industry would be abolished under the New York Health Act, which may sound rash. You know, you think, oh, but how could you take away that entire industry? Well, how could you let people die? I mean, what do we value more as a society? That's what we really need to decide. Do we want to pay more for less coverage and worse health outcomes? Or do we want to pay less for more comprehensive benefits for everyone and get better health outcomes? I think the answer is pretty clear.
It's clear. It's a no-brainer. But so I'm going to ask you all these questions that I know other people will be asking me. But what about the undocumented? How do they fit in?
Every New York resident is covered. So if you live here, you're covered. The newest version of the bill also has a provision for full-time workers. So if you work full-time in the state of New York, let's say you live in Connecticut or you live in New Jersey, we have a lot of commuters, as you know, coming into the state, you will also be covered under the New York Health Act.
Right, because you're paying taxes in the state of New York when you're working in New York, even if you may be living in another state.
Correct.
Yes.
I think it might put some pressure in the tri-state area for Connecticut and New Jersey, too. I mean, once people see how good this is, as I said, I think it's going to have a popcorn cascading effect.
Yeah, I hope you're right. So what is your model outside of the country? Like, how did you model this legislation on what?
Well, I did not write the legislation. The original bill was written by Dick Gottfried in conjunction with the New York State Nurses Association, who are, some of our biggest champions and supporters, and also New York statewide Senior Action. They're looking at different models. For listeners who, if you don't know, former Assemblyman Dick Gottfried, he's wonderfully wonky. He's a brilliant individual. He's looked and assessed, all the different types of models and came up with something that he thinks will work here in New York.
That's excellent. So we are in an election cycle, obviously, 2024. It's a big presidential election. What do you think we can expect in terms of what we can hear on the campaign trail, or what are the promises that you're hoping that at least one of the candidates will put forth when it comes to healthcare, health insurance?
Yeah, it is.
It doesn't look like anything is happening. But in any case, what did you expect?
It's going to be a bumpy ride. From a healthcare perspective, on a federal level, I don't know is just the honest answer. From a presidential candidate, I don't know what we will hear. I suspect if we hear anything as it pertains to healthcare, it's going to be status quo, preservation type promises. I do think we'll hear more from, folks potentially running for Congress. There tends to be more spirit, especially from challengers or open seats. And there are tons of us across the country advocating for universal health care. I'm excited for the elections on a statewide level because I think right now we're in some dicey political times federally, right? It's just that's the reality we're living in. So I've been devoting, most of my efforts and time on a state level where I think we can actually really affect change. And if we think about these movements as a long-term game, right? Which, as you pointed out, unfortunately, overturning Roe was not great, but getting to Roe was, that was a fight. Earning the right to vote, all of these things, they take a very long time. So I think that if we can focus efforts into passing it on a state level, hopefully in the next election cycle, the one after that, we'll start to see more movement federally.
Right. Well, it's always a good reminder that state elections matter and that state legislation is the legislation that affects your daily lives. Even in the case for Roe, of course, after that was overturned, it's only in the states where they have prohibited abortion does the Dobbs decision actually make a difference.
It does. And look, as you know, they do say, for a long time, states have been known as the democracy laboratories, right? So federal legislation often comes from state legislation.
Right. If it gains ground in states, then it's much easier to adopt on a federal level. So we are a pro-democracy podcast, and it feels perhaps like a really big question, but how do you think about the intersection of healthcare and democracy? Why is the good health of everyday Americans vital to the practice of democracy?
Yeah, I think there's a lot of ways that I can answer this question. I think on a larger scale, as I mentioned earlier, when folks have healthcare, when folks are able to get treated, whether it's allergies or it's diabetes, right? It affects the way we move throughout the world, right? We move throughout our spaces. So I think healthy people, lends itself to a more informed and engaged community on a sort of larger level. And it strikes me that, the New York Health Act is a health democracy bill. Right? When we think about what will this bill do to folks, and it will engage everybody because it leaves no one out, right? It's inclusive of everybody, and it gives individuals who don't have access to health care, can't afford health care, maybe are in an unfortunate way, the unhoused, the intersectionality of it all. It lifts us all up and it puts us on one playing field. And it's a real community-based approach. Even though it's a statewide community, it's still a very community-based approach. And I can't think of anything more democratic than that.
Oh, well said. Well said. So you ran for Congress in 2022. Tell us about why you felt that you had to run and how has that race informed your advocacy for the campaign for New York Health?
Yeah. Well, I actually ran in 2020 and in 2022. And I ran on a strong platform for Medicare for All. And I'll tell you a story. When I started to run, you're meeting with all kinds of different folks, community leaders, et cetera. And community leader after community leader told me, "Why are you running on Medicare for All? You're crazy. You will never get elected. No one will ever pay attention to that. You will get no support if you run on it." And I said, okay, well, we'll see. Because I don't believe candidates should run for office just to check some boxes and keep things the same. That to me is crazy. I ran for office because I'm a very strategic individual. It's very easy with a little bit of research to see many of the issues that are facing our country, and they're mounting. And there seems to be this resistance to change, this resistance to planning, and this resistance to implementing solutions. And I'm a mom of 3, right? And so that impacts everything that I do, every decision, because I'm worried about their future. I might be okay, maybe, although we're starting to see some of those effects, right? I'm 43, but I think a lot about my kids' future. And so when I ran because I wanted to offer people a choice. I wanted to offer people a new vision. I don't think it's good practice to wait until your house is floating down a river to, to think about climate change, for example. I don't think it is good policy to let people die or let people go into medical debt or make people choose between their medicine and their food or their medicine and their electricity. I think that's bad policy. And so I ran a campaign that was really a policy forward, and we did a lot of educating. And, lo and behold, I didn't win the race, but we won a lot of votes. We won a ton of votes. And I ran against an incumbent at the time, and we got about 1/3 of the vote for a very underfunded, no-name kind of race. And it was because I think our message really resonated with supporters. And when I ran in 2022, similar to the Democratic primary I was telling you about, in the 2020 race, the presidential, We forced the conversation. We made candidates talk about healthcare. And they wouldn't have talked about healthcare because many of them have run for many offices and they never talk about healthcare. But we talked about it and we made them answer tough questions and we educated our community. And interestingly, now when you poll our community, when you poll our congressional district, universal healthcare is wildly popular. Wildly popular. And that's that hard work of change, right? That's that nitty-gritty chipping away, chipping away. Yeah, I wanted to win. I ran to win so that I could represent my community and give them some planning and give them a real shot at life for our kids. But we changed a whole lot in that race, and I'm very proud of it. And I think a lot of what I learned there in those tough conversations is that as long as you meet people where they are, you bring the facts and you listen to people, you can move the needle. And I think it's why we have built a movement and a coalition in the Campaign for New York Health. And, there's been a lot of work done there before I got there, of course. But it's certainly my approach as we talk about healthcare policy to make sure we're not making any assumptions, right? That just because you belong to a certain political party, you should or shouldn't support. There are plenty of Democrats that don't know about this. There's plenty of Republicans that don't know about this. Plenty of independents that don't know about the New York Health Act. But when we talk to them about it like people and not a political party, we're able to build a consensus. And that gives me hope for the future. And that is why we have Republicans supporting this bill, individuals. We've got Democrats, we've got independents. And that's the kind of work that I know will lead us to victory.
Mm-hmm. Wow, this is very exciting. I love your passion. And also, I love that you moved the needle, changed the conversation, made sure that people understood that this is an issue that affects all of them and that they should keep their eyes peeled when they talk to their elected representatives, or if they're paying attention, hopefully they are reading the local news and what their electeds are doing for them. So we talked about this earlier a little bit, but what are two things an everyday person can do towards achieving universal health care?
Absolutely. So first and foremost, I would say call your legislators, call your assembly person, and call your state senator and tell them that you support this bill. You can very easily check to see if they're supporting the bill. You can go to the New York Health Act website, so it's nyhcampaign.org. You can check there. We have the bills linked so you can see. You can tell them, I really want you to support this bill. Here's why. Personal stories are always good to share. If they already are a co-sponsor, ask them, what are they doing? Can you be doing more? Tell them why it's important to your community. So first and foremost, that is a critical element, and it's something that anyone can do. And I promise you that legislators really do listen to their constituents, and it's very, very meaningful when they hear from you because almost no one calls their office. It's the same few people generally. So when they start to hear from broader constituents, it's very, very impactful. And secondly, I would say go to nyhcampaign.org, join the campaign. Get involved. If you can volunteer with us, we would love to have you. We are funded by people. If you can contribute to our campaign, that will exponentially speed up our progress and our acceleration in moving this bill. The last thing I would just say, I know you asked for two, but I think this is important. A lot of folks are feeling kind of down politically because there's a lot of hurt. There's a lot of pain globally, locally, and sometimes it makes you want to give up. And I think sometimes it's okay to feel that way for a little bit, but we can't let that consume us because no change ever happened by people giving up. The only way change happens is by banding together and chipping away and chipping away and chipping away, and then we'll all celebrate together. So don't give up and keep going.
Yeah, good advice. Good advice. So here's my last question. Looking into the future, what makes you hopeful?
Yeah, what makes me hopeful are young people. We've got so many people stepping up and paying attention to what's happening. But when I was a young person, we didn't have the internet, I think, until I was in maybe high school, early high school days. That's when the internet started. And we didn't just have this access to information at our fingertips like young people do today. And to see the way that they consume information and they get engaged politically and civically and they're out there leading and building, that is just so, so powerful, right? I think that's where I draw a lot of my inspiration. But I also do try to look to the past and look at these social movements that have taken some time. You start to see patterns. I went up to Seneca Falls last summer, and I was looking at the suffragists exhibit, and they called themselves radical optimists. And it was almost like this lightning bolt moment because it made me laugh. You know, when I ran for Congress, it's what people would say, oh, she's radically optimistic. It's like, well, someone's got to be, you know, because that's how we move the needle. That is how we change things. But these are the patterns, right? When you're trying to do something for the good of the community, for the good of people, they'll always start, they'll try to make you disbelieve. They want you to believe it can never happen. It's not true. So go back to the facts, right? Go back to the facts. When it comes to universal health care, remember that we're the only country that doesn't have it. Remember that we can get more and pay less. And remember that we can do it.
Wow, here. I love your enthusiasm. I love your passion. Thank you very much for joining us on Future Hindsight. It was really a pleasure to have you on the show.
Mila, thank you so much for all the work that you do. Really had a blast being here.
Melanie D'Arrigo is the executive director of the Campaign for New York Health. Next week on Future Hindsight, we'll be sharing an episode of a new podcast from Immigrantly called Nationally. You won't want to miss it. That's next time on Future Hindsight. And before I go, first of all, thanks so much for listening. If you like this episode, you'll love what we have in store. Be sure to hit that follow button on Apple Podcasts or the subscribe button on your favorite podcast app so you'll catch all of our upcoming episodes. Thank you. Oh, and please leave us a rating and a review on Apple Podcasts. It seems like a small thing, but it can make a huge difference for an independent show like ours. It's the main way other people can find out about the show. We really appreciate your help. Thank you. This episode was produced by Zack Travis and me. Until next time, stay engaged.
This podcast is part of the Democracy Group.